All right, good afternoon, everyone. My name is Jeff Cooper, Montgomery County Health Commissioner. Thank you for being here today so we can provide you updates on our community's response to the COVID-19 pandemic. On behalf of Public Health, we'd like to welcome our speakers today. We have Commissioner Judy Dodge from Montgomery County. We have Mayor Nan Whaley from the City of Dayton, Tracy Sibbing, Vice President, Community Impact, United Way of the Greater Dayton Area, and then Sarah Hackenbrack, President and CEO of the Greater Dayton Area Hospital Association. And I'm starting to wonder why we always have Sarah going last, and perhaps it's because she has a lot of the most important information in terms of our ability to respond to this upcoming surge. So it's not intentional that you're last all the time. All right. Yeah. So today, Governor DeWine had some pretty interesting talking points for all of us, and I'm sure most in the room today watched that news conference. His first topic was around hospital surge capacity, and we'll hear from Sarah later today about how our region continues to plan for that surge. I would like to stress, though, to everyone that those hospital planning regions that he referenced, and he showed a map that had 8 planning regions. Keep in mind, those are the same preparedness regions that we've been talking about here for multiple news conferences. And we've been planning as a system of partners within those 8 planning regions for emergency preparedness for almost 2 decades. And we've been planning with public health departments in those regions, hospitals within those regions, and public safety forces. That way we all understand what we need to do when something like this pandemic happens. And so all the health departments within those respective regions have similar plans, hospitals, as well as public safety forces. So those maps aren't new. What is new is that some of those regions are being consolidated. And so that now, in terms of an operational readiness for this pandemic, in terms of assuring capacity and level of care, we are within what's called Zone 3 now, which is a lumping of the West Central 8-county region and the Southwest 8-county region into one 16-county region for COVID response. And Sarah can talk more about that when she presents. The governor also indicated today that Director Acton from the Ohio Department of Health will be issuing an order, I believe we watched her sign it on the news conference, ordering hospitals that do not do their own testing for COVID-19 to be required to send those samples or specimens to another hospital that can actually do that in a more rapid time frame, because we know there are some hospital systems that have capacity to be able to respond and get the results back in a quicker turnaround time. So that's going to be very helpful. And then also today, just before I walked in here, the Ohio Department of Health issued updated criteria in terms of samples submitted to their laboratory for testing, and we'll make sure we place that information on our website. We're pleased today that Commissioner Dodge is here to provide an update on food security during this pandemic. The governor talked about SNAP benefits, having that ability for individuals using SNAP to order online and order from home. So that's a really good improvement for oftentimes our vulnerable populations. And then I found it pretty interesting that the Lieutenant Governor Husted talked about the stay-at-home order for essential businesses, and he specifically spoke to those essential businesses in retail, and he gave an example of Kroger and other stores like that where a large number of individuals may be congregating. And I thought his 7 talking points were really important. Keep space, 6-foot distance when you visit any store. Shop patiently. This is a very emotional and anxious time for all of us. We need to maintain our composure. Limit and consolidate your trips. If you don't have to go, don't go. There's no way on earth that everyone can use all that toilet paper. So oftentimes we don't need to go. Stay at home if you're sick. That's a message we've been saying from day one. Wash your hands before you visit the store, any store. Wash when you get home again. And then he indicated wear gloves and or a mask where needed. And then shop online. Obviously, most places are now offering curbside pickup and or home delivery. And that's really important. Those are actions that we as individuals can take. But I'm going to go a step further than what Lieutenant Governor said. And yes, those are actions that we can take as individuals. But that keeping space and that 6-foot distance and making sure that we're complying with the stay-at-home order for essential businesses in terms of social distancing, that's the responsibility of the business. It is your responsibility to enforce your requirements regarding individuals that come to your facility. And that's your responsibility then to limit the number of people inside that facility if you need to. All right. So, obviously, Public Health has talked at the past several news conferences regarding our work around essential businesses and verifying that they're in compliance. And so, keep in mind, we've said over the past several days that we've had anywhere from 250 to 270 letters that went out issuing an order requiring them to submit information to us. Well, that number is larger now, and a couple reasons for that. Number one, we're compiling all of our information from multiple sources. Keep in mind, we originally had phone conversations with businesses that called in asking for guidance prior to when we submitted or we issued the order. Plus, our information line continues to operate, and every day we continue to receive additional concerns from employees. So that number is about 360 now. And so over the past 2 days, our inspectors have visited approximately 360 work sites. That's phenomenal. I'm not sure that there's any other local health department in the state that has visited that number of facilities to assure that we are protecting our citizens. That's been done by 16 individuals. So you think about that over the last 2 days. They're at a lot of sites. But it's also important to remember that just because we issued an order doesn't mean that that facility is in violation. We'll ultimately determine who is essential, who's non-essential, who's complying completely, and who is not. And so as we identify that information, we will be, starting tomorrow, we will be issuing immediate cease operation orders for those businesses that are non-essential. And we will be having law enforcement accompany us when we issue those orders to immediately cease operation. And so that's a quick update from Public Health. And with that, I would like to welcome, Commissioner Judy Dodge to provide an update on food.
I just have to fix the mic. That's what I'm trying to do. So they can hear you better, Commissioner Dodge. So thank you. Try that. Okay. Hope it works. Okay, great. Okay.
Well, good afternoon, everybody. I'm Montgomery County Commissioner Judy Dodge. I wanted to give everybody an update on our emergency operations, help for employees and small businesses, public assistance, and our enhanced support for social service agencies in our community. Now first, the Montgomery County Emergency Management Agency has received additional personal protection equipment, or as we all know it, PPE, as well as other cleaning and medical supplies from the Strategic National Stockpile. These vital supplies will be distributed to those with the greatest need, such as healthcare providers, EMS, fire, police, and long-term care facilities. Now we have good news. The U.S. Small Business Administration just announced a new program to help companies keep their workers employed during this epidemic. It's called the Paycheck Protection Program. It's a direct incentive to allow small businesses to keep workers on their payroll. Now, the program is described as a loan, but the SBA will forgive these loans if all employees are kept on the payroll for 8 weeks. And the money is used for payroll, rent, mortgage interest, or utilities. Now, this new program will be a massive help to our area's businesses and workers. In addition, I want to remind everyone that unemployment benefits have been enhanced and expanded in the state of Ohio. I know a lot of you are so frustrated by this, but we encourage anyone who has lost work due to the virus to apply using your phone or computer at unemployment.gov.ohio. We know that there are long wait times online and over the phone with the state unemployment office, but please do not give up hope. Be patient and persistent. You will get your help. Our workforce development team is still working with companies who are hiring, so interested applicants can call 937-225-JOBS or 225-5627. Public assistance. Our public assistance division has seen a daily increase in the number of citizens who are applying for social services. Currently, we have 70,000 individuals and families on Supplemental Nutrition Assistance, or SNAP, more than 5,000 requesting emergency assistance through our TANF funds, and more than 134,000 on Medicaid. I have to thank our staff at Job and Family Services who are working so hard to process this increase in applications. Now finally, the county has agreed to assist with funding 3 critical service areas during this virus to ensure a strong social services safety net for our most vulnerable citizens. These 3 critical service areas are senior citizen services, homeless solutions, and food equity. We are working with the Area Agency on Aging and the Frail Elderly Services Advisory Committee to continue to monitor the needs of our seniors to be sure that they do not become isolated and that we are able to respond to all their needs. Montgomery County is also the oversight agency for homeless solutions in our community. So our team is working to identify needs and deploy resources. For example, last week we allocated $65,000 in emergency shelter to the St. Vincent de Paul. Through federal and state agencies who provide the primary support for the homeless network, we have identified almost $2 million that will be coming to Montgomery County through HUD to assist with homeless and housing needs. Through our Homeless Solutions Policy Board, we will work with community agencies to develop a prioritized plan for how these funds are used to meet the needs of our most vulnerable citizens. Finally, we are working together through our Food Equity Coalition to understand what our community partners are doing to provide healthy food to our citizens now and where there may be gaps in the services that need to be addressed. You can sign up to volunteer with local nonprofits by visiting our website at mcohio.org and push the tab at the top of the page about the virus. Thank you for your time. On behalf of my fellow commissioners, Debbie Lieberman and Carolyn Rice, we want you to be safe, stay healthy, and please wash your hands and stay 6 feet away from everybody. Thank you so much.
I'd like to welcome Mayor Nan Whaley.
No, you're good. Hey, well, good afternoon, everyone. A couple of comments today, but first I want to just commend Public Health and Commissioner Cooper's work. When you think of the 370 businesses that 16 people went to really ensure that people are following the law, to make sure that our community is staying safe and people are being treated fairly. This is part of that healthcare network that we're so lucky to have, and we certainly appreciate the consistency of Montgomery County Public Health following the order and the work that isn't very fun sometimes that these folks are doing on the front lines every single day for our community to stay home and save lives. So first, today is April 1st, and there are no April Fool's Day jokes I've noticed today, mostly because everyone thinks that this might just be a terrible dream we're all in as we're working through this for the past month. But there's two things going on today that I want to make sure everyone pays attention to. First, it is the first of the month, and so we recognize that a lot of our folks have a lot of bills due today, including rent and other sorts of must-have needs. And so, again, we encourage everyone that is having issues with their rent or wants to know what the rules are on evictions to go to mvcovid19eviction.com. But also we've put forward a standard letter that we've put on Facebook and Twitter and other sites you can find really quickly on my site, for example, that is a standard letter that you can send to your landlord if you're having issues paying your rent, so you can try to work with your landlord so we can get late fees lifted as we go through this process. I want to say something pretty important here too. I've noticed that nearly all landlords have been pretty flexible during this time, particularly considering that they have mortgages to pay too. They have been really willing to work with folks that have loss of income around a loss of a job. So I want to thank the landlords that are willing to do that. I've gotten some emails back just today of people that have asked their landlords, said, hey, I've been a good pay, are there things that we can do to help? And they've been willing to do that. And I want to say I appreciate everybody being in this together. So if you are not able to pay your rent, number one, do not move out. Number two, see if you talk to your landlord with this letter to see if there are ways that we can get some late fees waived. And then number three, you can see what your rights are on mycovid19eviction.com. mvcovid19eviction.com. It is the longest email. We put it at the bottom of each one of these every day. Secondly, today is something that happens once every 10 years, and that is the census. Today is Census Day. And so we're encouraging everyone, if they haven't done so, to do it today. We have some interesting time or different kind of time available. We ask people in the city of Dayton and Montgomery County and the whole region really to make sure that they have put in and done their census. I did it today. It took me 7 minutes and 20 seconds. That was while I was reading the questions out loud, so it is not that long to do, and it is pretty easy. It is very easy, actually. It is vital to our community. Let me tell you why. Every single person that fills out the census, that equals $1,800 per person per year in our community. That allows us to do the services that we're using right now. The amount of dollars that we receive from the federal government regularly and the state government regularly is based on how many people fill out that census in our community. So when we're talking about the needs for the homeless, or we're talking about food, or we're even talking about the enforcement of our public health, those dollars that we get and the grants that we get come from you filling the census out. So while we're in this disaster, take the time to help us fund what we need when we don't know when we're going to need it by filling out the census. You can go to census2020.gov. It is super easy, and there's places where you can ask questions and even a toll-free number as well. We have that posted as well. That's all I have today. Thank you, Commissioner Cooper.
I'd like to welcome Tracy Sibbing from the United Way of the Greater Dayton.
Good afternoon. I wanted to share with all of you, first, I feel really compelled to say thank you to not only the leaders in our state, but within our community who have really done just a phenomenal job to really keep us all safe and protected. And so for that, I have an enormous amount of gratitude, and I feel like everybody who's watching, you should know that they have our best interests at heart, and it's demonstrated every day, especially through press conferences and information sharing, which is so vital to keep us all informed and all safe. 211 is an information and referral line that United Way operates, and I want to assure you that we have done everything that we need to do to remain 100% up and operational. So what that means is that folks in the community can contact HelpLink 211 by dialing 211 any time of the day, 24 hours a day, 7 days a week, and we will answer that call and direct you to the resource that you might be in need of or looking for. I will say, and I'd like to share with you a little bit of data through the month of March. We've been monitoring the data as it comes in. The first week in March, we had 43 requests for food. In the third week of March, that jumped to 245 requests for food. Now, I want to just let you all know that that spike and that increase both was different in terms of the demographic. We have a much larger population of 18 through 40-year-olds that are requesting that, and I think that coincides with the governor's order to shut down the service industry, bars and restaurants. So folks who normally work every day and have everything they need to provide for their family really had some concern and reached out to 211, and I'm so grateful that we were there to answer the call. But I also want to give a huge shout out to the food bank and Michelle Riley. They have stepped up and they continue to meet this increased need that we have in our community. To reiterate something that Commissioner Dodge said, there is a lot of work happening right now in a very collaborative and cooperative way. Another plug for our community. We're amazing in that way. We do this all the time. We come together to figure out what the best solutions and path forward are. And we are actively right now gathering all the necessary data so that we can identify the gaps for folks in our community who both need food but don't have the transportation to access the normal avenues that we have in place. So we will keep you updated on that. Again, I do believe Commissioner Dodge mentioned volunteer opportunities. That link on Montgomery County's website is the same as United Way and Declare Dayton. It all goes to one spreadsheet so that we can compile this information and put plans in place to connect volunteers with the opportunities that are out there. But I was reminded before I came on to speak about this to remind folks that you need to make sure that you are able to volunteer, you're not in a vulnerable age group, that you're practicing all of the standards to keep safe in terms of 6 feet, in terms of making sure you wash your hands, and to be safe throughout the process of volunteering. We know that we're going to have a need in this community to have folks volunteer, but we want them to do so in the safest way possible and to assure that everyone in our community has what they need during these difficult times. United Way 211, please feel free to call it if you have a need and you need to be directed to some services. Stay healthy, stay safe, and stay sane. Thank you.
Thank you, Tracy. And now, time for Sarah Hackenbrack from the Greater Dayton Area Hospital Association.
Good afternoon, everyone. Thank you, Commissioner Cooper. Thank you, Commissioner Dodge, Mayor Whaley, and our partners at the United Way. Really, truly, I think what you're hearing today is a theme that we have been discussing periodically throughout this crisis, and we're talking about how the Dayton community is different, how the Dayton community works together, and how our region collaborates. And from a hospital association perspective, I really want to take this opportunity to emphasize that that is exactly what we see happening right now with our region's hospitals. Our member hospitals have been meeting in a series of groups and organizations, from human resources professionals and infection control and emergency preparedness staff to our chief clinical officers and our medical directors, along with system and hospital leadership, to really understand how we can better collaborate to serve the needs of this community as we prepare for the surge that is coming. And those meetings and conversations are something that I recognize that I have a unique lens and perspective into, and I get to see them every single day, set aside their organizational boundaries, set aside organizational challenges or issues or even past history. And in this time, right now, they are working together to try to make sure that we have the maximum capacity physically within our infrastructures here in the Dayton region available to care for people in our community. And as we continue to build out those plans and we link in with new partners through the Ohio National Guard, we are also now looking at our external capacity in the community and looking at how we can better partner with our Ohio National Guard partners and bring them into the spirit and the way in which we work here in Dayton area. And as we continue to look at the plans that we are building, it is also critically important to understand that when we're talking about capacity to address this surge that is coming, it is not simply a matter of physical infrastructure. We have to work with our Ohio partners, we have to work with the Ohio National Guard, the governor's office, as well as the Ohio Department of Health to ensure that we have the necessary medical equipment and supplies to equip those new spaces that we're creating in our region's hospitals. And then we have to ensure that our resources from a workforce perspective are ready to jump into action when we need them. And so that collaboration and that information sharing and the preparation work is ongoing in our community. And I think as we continue to move through this process, it's vitally important to understand that there is no one static plan, as Director Acton mentioned earlier this week in her press conference and statements. We are continuing to go back to the drawing board and evaluate and reevaluate to retool to increase capacity, to increase the opportunities to work together. And that is why we are continuing to have these ongoing conversations internally with our hospital partners and then externally with our partners at Public Health, our county EMA partners, as well as all of the social service agencies like the United Way 211 who are going to be critical to helping the people and the patients that we're going to serve inside of our region's hospitals. All of the other things that every single person in this room and everyone watching deals with on a daily, day-to-day basis won't go away. And so it will take all of us working together to make sure that we do come out of this surge and out of COVID-19 a better and stronger community on the other side. Thank you.
Are there any questions?
Yeah, I was just going to ask, do you know when the Click and Collect program will roll out?
Could you repeat that question?
The Click and Collect, I think.
The governor announced it today, right?
Yeah.
Yeah, do you? I don't. Mayor Whaley's going to try that answer.
I think that's a better question for you to ask Kroger's or the other food services. What you're talking about is this Click and Collect. The governor announced it, so folks that are on SNAP benefits don't have to go into the store, don't have to bring their children in. We're trying again to do everything we can to keep social distance and save lives that way, and so this is an effort. I am assuming that since the governor announced it, that it is very close, if not already, ready to be rolled out today.
But all my questions have to do sort of like.
Oh, okay, you got it.
You don't mind. So I guess along with that, do you know how many people in the county are under SNAP benefits?
I don't know. Do you know what it is, Tracy?
70,000.
70,000.
And then just how does this benefit low-income families during that?
SNAP and benefits in general, how does, okay, so there are 70,000 people in the county. Thank you, Commissioner Dodge and Tracy Sibbing for the number across Montgomery County on SNAP benefits. Why does this program that the governor announced today at 2 benefit our community? Look, we don't want people that are any income, low income, middle income, or high income, doing things that put their health in order to get what they need, right? So the food bank, for example, when they did their latest distribution, there were cars, so people could just drive through, get their food delivered. We're encouraging people to shop online and maybe just pick it up and have it come to their car, especially if they are in those special segments of the community that could be more susceptible to the virus. And frankly, we don't want people, and I said this 2 days ago, we don't want people, any sort of folks, huddling into retail places, right? So again, if you must go to Lowe's, if you must go to Home Depot, pick times that aren't as busy. Make sure that you're maintaining the 6 feet distance. We cannot reiterate how important this is, or hey, maybe you wait until the emergency order is lifted and not go. So we have to get food, and so making sure that people that have SNAP benefits can get their food in a safe manner or in the safest manner possible is why this is so important.
Okay. while you're up there, do you have any thoughts or concerns about the census and everything today because of not only COVID-19 but the tornadoes?
Yes, yeah.
What are you looking for?
So the question was, do we have concerns about our census count for 2020? Yes, I think everyone in the country is worried about their census count now on April 1st, so we're all in it together when it comes to that. But we really need people to pay attention and do this action right now. And what normally when we're organizing census events, for example, I did the census today at home. I was supposed to be on an RTA bus with 30 different people. We didn't want to do that to raise the awareness because we want people to do it from their home to be safe while they're filling out the census. You know, we're exasperated by this issue in the county and the city because of the displacement we have of folks that have been moved by the tornado. We have some agreements about that because of the disaster that happened, but it's still a big issue. And where the tornado hit are hit in places that are normally underreported in the 2010 census. And so those are things that we've tried to normalize, and then COVID happened. So really, we can't say enough about how important today is and how important it is to take the time, take the 7 minutes, and do the census.
My other questions are just for Sarah.
Sarah always has questions.
I know.
Yeah.
So Sarah, just looking at, I know you were just talking about, obviously you guys are, it's just a completely always evolving door, moving number and stuff. Do you have an idea of, like, for resources like ventilators, how many maybe we have locally or how many we need, things like that?
So the question was, in terms of resources, specifically about ventilators, how many do we have and how many do we need? We do have the ability to ask that question of our hospitals, and they were reporting that information into our region as well as to the state, and so we're actively tracking the number of ventilators that we have currently in our community. Our hospitals are also checking on the status of those ventilators because sometimes those ventilators are actually in use in the hospitals on a given day. So there's no one specific number of how many ventilators are available in each community because there may be 2 patients on a ventilator in a community on a given day, and then there may be 7 ventilators in use on a day later. What I can tell you is that we have over 60 ventilators in our emergency preparedness cache that we are actively deploying in our region and making sure that we have some of those pre-positioned in areas where we already know they have a lower number of ventilators than what we would like to see them have right now.
Okay, and then just as far as, like, again, talking about the possible surge, I know you talked about opening up, like, regional shelters and things like that. What are the plans right now as far as increasing bed capacity?
So the question was, what are our plans in terms of increasing bed capacity and looking at other alternate care sites? That is an active and ongoing conversation, and so our members are already looking at increasing their internal capacity within each healthcare infrastructure facility. That is our first activity in order of business when we think about how to prepare for the surge that's coming. So we are actively increasing our internal capacity, and then we will also be working with external partners who are healthcare providers to help us serve those individuals who may not need COVID-19 support but might need health care, and we can provide that in other external care environments like a rehabilitation facility or a specialty care hospital that maybe has traditionally had behavioral health beds, but we could safely recuperate someone in that space as long as they're not a COVID-19 patient. So those plans are active with our healthcare partners, and then we are welcoming our Ohio National Guard partners into this conversation as well to help us evaluate the external alternate care site options for us.
So I would like to make one additional comment regarding the question on SNAP. So public health is charged with assessing the health status of our community, and I think we've shared before that we release periodically a community health assessment. Maybe during this pandemic, as individuals are staying at home, it might be a good time to look at this on our website. The data are fascinating. At least to public health people it is, because let's face it, we're data nerds. But we use this information to then get better as a community. And when you look at how the data are organized in here, it's pretty clear that there are disparities in health outcomes. And those exist for a variety of reasons. And a lot of those fall along the socioeconomic status of various individuals. Not everyone is as fortunate as everyone else. So in particular with SNAP, that Supplemental Nutrition Assistance Program, many individuals really need help just meeting their daily living needs in terms of food. There are a lot of data in here about food insecurity. And the nice thing about having this then announcement from the governor today is it really promotes health equity associated with this stay-at-home order. And that's really important. We want to make sure that all citizens have equal opportunity to be healthy even in this time of social distancing. So.